Hi, am I focused? Yes, I am. Hello, everyone. Thank you so much for joining. I'm Dr. Sylvia, a general practitioner and health educator with Ask Away Health, and I'm so pleased that you could spend a few moments of your time with us this Friday afternoon or evening, where we're talking about ovarian cysts, as you can see from the title. This is Ask Away Health, where we discuss everything that would help you live better, so give you more information about your health, not just yours, your friends, your families, kids, sexual health, women, men's health, everything, the whole shebang. So thank you so much for joining me today. I hope you're doing well. We're just going to get right into today's session where we're looking at ovarian cysts and looking at 10 common questions. Of course, there are more than 10 questions around ovarian cysts, but I just wanted to just condense this discussion for us this evening. And of course, if you have any questions or comments relating to the topic, by all means, please drop them for me in the comment section and I will go through them as we proceed. But let's get started because there's quite a few things to go through and I hopefully don't want to keep us too long. Please give this video a like. If you are joining, if you're watching this live, let me know where you're watching from. Do let me know where you're watching from. How you doing? How's your day been? Are you looking forward to the weekend? Believe me, I am definitely looking forward to the weekend. But yeah, let me know where you're watching from. And if you're watching on the replay, please don't forget to give the video a thumbs up. That would be much, much appreciated. Okay, so before I get started, just to remind you that if you do have any specific questions that we can't cover in the session, and many times that's the case, please reach out to me via the website. The link will be in the description box below. It's our email health information service, very easy to use, and we're there to provide accurate health information regarding whatever symptom you want to talk about. So please use that if you need to. So we're talking about ovarian cysts. Let me just start with the first banner and the first question we're going to tackle, which is what are ovarian cysts and how do I know if I have one? I'm just going to take this away if I remember how to take it away. Yeah, okay. So let's look at what the ovaries are. I'm going to show this to you. Hopefully you can see that. Yeah, so we're talking about the ovarian cysts, and let's talk a little bit about the ovaries. The ovaries, of course, are the reproductive organs in women. We have two ovaries, and I'm just trying to make sure that I've got these things in place. So let me remove that so you can see the whole picture. So a woman has two ovaries on either side of the womb, connected to the womb via the fallopian tube. The ovaries are very important organs because they're responsible for producing the egg, or they are the store for all the eggs a woman will ever have. And every month during a menstrual cycle, they release a mature egg, and they also produce hormones. So the ovaries are very important organs for reproduction in the woman. But let us come to the nitty-gritty. What is an ovarian cyst? So an ovarian cyst is a fluid-filled sac. I hope my sound is okay. If you are watching this, let me know, but let me just quickly do a check because I don't want to say all this and then somebody says, oh, we didn't hear you at all. That would be most painful. Let me just quickly have a look and make sure that my sound is doing fine. Where are we? So let me just check. And if my sound is fine, then I can carry on. Otherwise, I'll have to start off right from the beginning again. But hopefully we should be sounding okay. Let's see. Yep, sound is there. Fine, lovely. Okay, so an ovarian cyst is a fluid-filled sac or bag that happens on the ovary. Okay, that's what an ovarian cyst. A cyst can happen anywhere in the body, and a cyst is a sac that's usually filled with something. Sometimes they're empty, but most of the time they're filled with fluid. And these ones are developing on or within the ovary. Ovarian cysts are very common. Many women hear ovarian cyst and it sounds like something that is an unusual occurrence. Actually, they're not, but very, very common. And many times, which is why many women don't know much about them, they don't have any symptoms. So we may go around with these cysts on our ovaries, but not even realize that we have them because they're not causing any trouble, okay? But if you do have symptoms from an ovarian cyst, it might be difficult to tell because many of the symptoms that you have can also happen in other conditions that can affect women. I'll talk about that in a moment. So it may not be so easy to tell without a doctor either examining you or going to process some tests or doing further evaluation for you, whether it's scans or blood tests. You may not know. So it's not so easy to know if you have one just by how you feel, but being aware of symptoms or a change in your normal well-being is a good indicator. And the symptoms can happen differently from one woman to another. That's something that's important to also remember. Now, other facts about the cyst is that they can happen at any age. Okay, so they can happen in children or young girls. They can even happen in very young toddlers. They can have cysts. Yes, I know that sounds crazy, or well, not, that doesn't sound usual, but they can happen. So you can actually have cysts that develop right from birth. That's what I'm trying to explain to you. But they can happen in women as they're growing up, after puberty. They can happen after pregnancy or during childbearing age. They can happen around menopause and so on. So they can happen at any age, okay? And as I've said many times, they happen without symptoms. But even when they do develop symptoms, most of them can go away without any treatment. And we'll talk about the treatment options. I do want to talk about the different types of ovarian cysts before we go to the next question, okay? And the one more thing I'll say about cysts is that they can happen at the same time on both ovaries. So we're talking at the moment about what are ovarian cysts, how do I know if I have one, and we've talked about what they are. These are cysts that grow on the ovary. We've said that they can happen at any age. They can happen on both ovaries at the same time, or they can happen on just one of the ovaries. So now let's look at what are the types of ovaries. The most common types of ovarian cysts are known as functional cysts. They're usually harmless, these types of ovarian cysts, and they're the most common. They happen along the path of a woman's menstrual cycle. So see what happens in the ovary before a woman has her period during the menstrual cycle. And if you want a proper review of this and a description of what happens, I do have videos in the channel that are dedicated to this. So please do check them out. But at some point, the follicle in a woman's ovary starts growing, and it becomes mature, and that follicle contains an egg. And as the egg grows within the follicle, as the follicle and the egg get up to a point where they're mature, the follicle bursts and releases the egg, and that egg travels down the fallopian tube into the body of the womb. And if sexual intercourse does not happen, if the woman does not fall pregnant, that egg is shed as menstrual product or menstruation. So that is all the process that happens. Once that egg is shed, the whole cycle starts off again. Another follicle in the ovary starts to grow with an egg inside it. Sometimes along the way, something happens in that process. Either the egg doesn't develop in a particular follicle, so the follicle just starts growing and it becomes a cyst, okay? Now, there are different types, and so this is functional. This is what is happening during the ovaries function along the menstrual cycle, okay? So you can have a cyst developing because something went wrong. It's not going to cause serious abnormality, but something in the mechanics just didn't result in that follicle with that egg progressing to the point where the egg can be released for ovulation, okay? So that way you can develop a functional cyst, and that type of cyst is a follicular cyst. After ovulation, sometimes what is left, the follicle that's left behind, should degenerate or should disintegrate. The body should get rid of it in some way. And it has its process for doing that. Sometimes that process doesn't work out and it doesn't go as planned. And so you could end up with that product, that follicle that had released the egg. We call it a corpus luteum. It just persists. Instead of disintegrating, instead of the body removing it as it will do normally, that persists and it becomes a cyst on its own. That's after ovulation. So these are functional cysts, okay? They happen along the path of the ovaries function during the menstrual cycle. They're the most common type of cyst. That's the most common that most women will experience. They are usually harmless. Very important to say. They're usually harmless. Now, they can grow to different sizes. Okay, some of them can grow to different sizes, so they could cause problems like pain or they could burst, or some bleeding might happen in them. And so they could cause some problems that we should be aware of. But in the main, these functional cysts would usually settle down by themselves and not require treatment. So that is the first type of cyst I want to talk about today. And I think I have an image describing that. Let me just see if I can pull it up and show you. So here's what I was just talking about. I hope you can see this. Let me remove the banner here so you can see it. So this is just a high frequency or high resolution image looking into the ovary and looking at the follicles. So you can see this is how the cyst potentially can form. Towards one corner of this image, you can see the egg in the sort of towards the side that's developing. So what we're saying is that if this process where the egg matures and should get released doesn't happen as it should do normally, a cyst could form. And I have another picture somewhere here. So this is just telling you the story of ovulation, which I've just explained a couple of moments ago. So within each ovary, you've got follicles that will develop. The hormones that your body produces stimulate this activity. So a follicle will start to grow with an egg inside. They're growing up to the point where they're both mature. And at the time of ovulation, that egg is released. After the egg has come out, you have the corpus luteum that I was speaking of, and that's just the follicle, the old follicle that the body is going to just remove as it would normally. If something goes wrong in any of these processes, that's when you could have a cyst developing, and that type of cyst is a functional cyst. That is the most common type of cysts. So I have Zianda saying hi from South Africa. Hello, thank you so much for joining. I'm so pleased. How is the weather in South Africa treating you today? But thank you so much for joining. Nice to have you on the show. So we're talking about ovarian cysts, and I'm at the moment trying to describe different types of cysts. I've just talked about functional cysts. I've talked about how they happen. They could be follicular, they could be corpus luteum cysts, they could be hemorrhagic. Don't worry about these terms. You may hear them, your doctor may talk about them, but I'm just using them to help to clarify what I mean by the different types of functional cysts. The next one I want to talk about is an interesting one. It's peculiar. And again, it's not very common. But when peculiar things happen, they remain in your head. So I'm sure many people are going to think, oh my goodness, is this what is going on in my body if I have a cyst? Probably not. But I'm referring to what's called a dermoid cyst. And I think I have a nice picture of that one as well. Let me see if I can put it up. So I'm talking about what's called a dermoid cyst. And for the sake of anybody who's just joining, I'm here talking about ovarian cysts and how you know if you have one. And I'm describing now a type of ovarian cyst that's known as a dermoid cyst. So this one looks a bit scary, a bit creepy. And it's actually described as a cyst that happens in the ovary. Okay, but the cells of the cyst actually produce hair or skin or teeth. So this can be a bit, what's the word now? So it can be a bit gross to look at, but it is possible. It is not very common, but it can happen where because of some change or some abnormality in development, and sometimes this can happen from birth as well, you have hair or teeth or skin growing within a cyst of the ovary. Of course, you know that shouldn't happen, but we have found cysts that look like this, dermoid cyst. Now, would you believe that dermoid cysts usually are benign? So they're not cancer. I know the look belies that, but they're not cancer. They're usually benign, but they can grow quite big. That's one of the problems. They can grow quite large and so cause pain and other symptoms that we're going to look at when we talk about symptoms of ovarian cysts. The next type of cyst, so our number 3 type of cyst now, is an endometrioma. And for those of you who are familiar with the term endometriosis, then yes, this is related to endometriosis. So an endometrioma is a type of ovarian cyst. Now, and in endometriosis, I've got lots of videos on endometriosis again in our channel. So please settle down, go and have a look if you want to learn more about this topic. But this is when tissue that is not supposed to grow in the womb lining now begins to show up in other parts of the womb. So this is what this means is that tissue from the lining of the womb, the inner lining of the womb, starts to grow in other parts of the body. It can happen, the womb lining can grow in the fallopian tube, it can grow in the ovary. In some cases, it can even leave these organs and grow in the pelvis itself. But when it grows, that is womb tissue, grows in the ovary, it forms cysts, and these are called endometriomas. Now, the problem with that, of course, is that it's going to damage the structure of the ovaries. So it will affect how the ovary works. This is not like the functional cyst that we just described, which we say happen along the path of the ovary's normal function. This is quite different. It damages the structure of the ovary, so it will cause abnormal bleeding happening from the ovary. It can even cause scars to form in the ovary. So the ovary can't do its job properly. So when endometriosis happens, if a woman has endometriosis and her ovary is one of those areas that are affected, it could lead to cysts developing, and this can have an impact on fertility, being able to conceive. So again, we're talking about different types of cysts. We've covered a few, and I just have a couple more to talk about. A cyst adenoma is a very large type of cyst that is in the ovary that's filled with a kind of sticky or watery fluid. Again, tends to grow quite big. And another one that I'm sure you will be familiar with and hopefully be aware of, because we want women to be aware of these conditions that affect us, is polycystic ovary syndrome or polycystic ovarian syndrome, which is where there are abnormal hormone production and you have multiple cysts on the ovaries. So you have abnormal levels of estrogen, you have abnormal levels of testosterone compared to a woman who does not have PCOS. And when a woman has PCOS, she has different types of symptoms like irregular periods. She might have, she may be overweight. She might have acne, excessive hair, and the other symptoms can also happen. So we're talking about ovarian cysts. We've just looked at the very first question, which is what are ovarian cysts? And we've gone through what the cyst is and the types and some interesting facts around them. So we're going to go to the second one. Let me know if you're finding this useful. Please give this video a like. I would really appreciate it. And of course, any questions. So we are going to the second, and we're looking now at the symptoms of ovarian cyst plus how they are diagnosed. Let me start with the first. So symptoms of ovarian cyst will usually depend on the type of the cyst, but most times this cyst will grow large, and so the symptoms are also related to size. So pain is one of the symptoms that can happen, and that's pelvic pain, because just think about a cyst that's growing on the ovary, either on the right or the left side. Let's pull up our ovary picture again. There we go. So imagine a cyst on the ovary and it's growing bigger and larger. It's going to put a lot of pressure on other organs like the nerves, like the fallopian tube, like the womb, like the bowel. So before long, a woman is going to complain of pelvic pain. She's going to complain of feeling bloated, or if she eats a little food, she feels full very quickly. There'll also be problems like troublesome periods. We've just talked about PCOS, where you have irregular periods. So women could complain about heavy periods or lighter periods or irregular bleeding pattern. All this can happen if a woman has an ovarian cyst. It could also lead to painful sex, because again, the ovaries are getting larger and larger, taking up space, pushing against the womb, the cervix, the vagina. So it makes having sex difficult, or it makes it difficult to empty the bowels because the cysts are growing so big, they are pushing against the bowels and the bladder. So they might be wanting to go to the toilet to pass urine frequently because the bladder is being pressed on, so it can't really hold much urine. As soon as a little urine goes in there, because the bladder is being squashed by the ovary, the big ovary, you feel like you want to go and pass urine. So those are some of the symptoms that women with ovarian cysts might develop. Another thing is that as the cyst grows bigger and bigger and bigger, it might burst. That can be very, very painful, extremely painful. That can be a medical emergency, the pain. Plus the fact that the cyst has burst, it's releasing material into the pelvis that might cause bleeding, might be infection, and so on. So these are some of the cysts that can happen in with ovarian cysts. For cysts like the ones in PCOS and endometriosis, I've just mentioned, there can be fertility problems. So that can happen. And of course, it depends on the degree, okay, the degree of how bad the cysts have developed in each of these conditions. Because with PCOS, you know, we have different degrees. Not every woman with PCOS is unable to fall pregnant, so it has different degrees. Okay, so that is looking at the second question tonight, which is what are the symptoms of ovarian cysts and how they are diagnosed, is the next bit of the question. Now, your doctor will examine you when you come and sit down and talk about these symptoms. So we can examine your tummy. That might not tell us much. If the cyst is so large that we can feel a mass, then there's a clue that something might be going on. But how do we know it's not fibroid? How do we know it's not something else going on? The next step will be to have an ultrasound scan. So one of the most common tests you will have, and usually the way that we identify that there is a cyst, is an ultrasound scan of the pelvis or abdomen, and that tells us that the ovaries have grown to such and such an extent, and the diagnosis is made. Some blood tests can be useful. There are some blood tests that look at chemical markers, and particularly for ovarian cancer, and I will talk about that in a little bit. So your doctor might also want to do a blood test which will tell us or suggest to us that this swelling or mass in the pelvis or abdomen is related to the ovary. Okay, so there is blood test and ovarian and ultrasound scan are the tests that we will do. All right, so let's go to the next one. What causes ovarian cysts to develop? Yes, why do some women get ovarian cysts? Why me? Why her? Like many things in medicine, we don't know. I know you're not surprised to hear that. We don't know. But I've explained the most common types, that is the functional ones. They happen along the pathway of the menstrual cycle. So we think as the process is going on, something goes wrong somewhere, but the body, organizes itself and then things continue. So a functional cyst may happen because for some reason a follicle started to grow and there was no egg in it, or after ovulation, the corpus luteum was supposed to be disintegrating, but it didn't. It just continued growing. Some things like that could happen, and they may cause cysts to develop. That's one thought. Other possibilities are certain drugs, and in particular, fertility drugs. So for women who are going through IVF treatment, there's some fertility treatment drugs that can increase the risk of developing ovarian cysts. So that's something to be aware of, and which your gynecologist and your obstetrician will discuss with you about possible side effects of any fertility treatments that you are having. Another thing that could be responsible, we think, is the hormone imbalance that happens, particularly around the time of pregnancy and menopause, because then hormone levels are changing during pregnancy to accommodate the baby, and during menopause, naturally happens that the reproductive hormone levels start to drop around the time when a woman is menopausal. And we think that imbalance might just provoke cysts to start growing. So what causes ovarian cysts to develop? We're not 100% sure. We don't know exactly, but we think certain things could make it more likely to happen than others. Okay, so let's look at what are the treatment options for ovarian cysts. So I've talked about quite a few of them. So I'm going to go through and just mention them one after the other. The treatment option depends on the type of the cyst that you have, as well as its size and any symptoms that it's causing. So it might be nothing. Yes, it might be nothing. And that's very common if somebody has a functional cyst. The first type I mentioned, that one that happens because of the menstrual pathway. Because usually those cysts, those type of cysts actually go away by themselves. It may take a few weeks or months, but they do go away. However, if they've grown quite big or they're causing troublesome symptoms, then it might be that we will do something about them. And most often it will be to have surgery to remove them. But in terms of functional cysts, you may not need to have any treatment unless they're very large or they're giving symptoms. So often it's just to watch. So you may have a number of scans. You may have the first scan and they say, oh, this looks like a functional cyst. Don't worry about it. Let's keep an eye on it. Then they call you back after a few weeks to repeat the scan to see whether the cyst is shrinking or whether it's the same, or and so on. That's what monitoring means. So other types of cysts like the endometrioma, which is the one that happens in endometriosis. So that will probably need surgery, and particularly if it's causing symptoms, or we're looking at fertility options. And of course, it depends on how large the cysts are, whereabouts they are. Remember, I said that they can affect the structure of the ovary. They can even damage its structure. So a few things would have to be looked at. It depends on specifically what condition those endometriomas are causing. Other types of cysts like dermoid cysts, That's the one that contains teeth and skin. And like I said, they're benign, but they can grow quite large. And so what the doctors or the surgeons can do is remove them, just sort of take them away, and generally will not affect a woman's fertility. And the other type is the cyst adenoma, which is the same. As it grows bigger, it's causing problems like pain, and the bulk is pressing on the other organs of the body. So of course, the treatment would be to remove them. For something like polycystic ovary syndrome, and I talk about this at length in a couple of other videos, treatment ranges from different things depending on a woman's symptoms. So it could be that all a woman needs to do, if she has mild symptoms and we're just trying to control her periods, or control hair, excessive hair or spots and all that, it may be that some of the things that she needs to look at are healthy eating, losing weight, having a regular exercise pattern just to keep herself healthy. Women with polycystic ovary syndrome can be at an increased risk of developing diabetes. So keeping a healthy weight and exercise, a regular healthy diet will be helpful to reduce the risk of that happening. Some ladies, if they have troublesome periods, may need to have birth control just to help to keep the periods calm. Some ladies may have trouble with conceiving, and so we need to look at that specifically. Sometimes they might benefit from having surgery as well. So there are different options. It depends on what symptom in particular is affecting each woman, and it varies from woman to woman. So these are some of the treatments that you could have when you're looking at ovarian cysts. So guys, we're talking about ovarian cysts, looking at 10 common questions. I really appreciate if you're watching today. I hope you're finding this useful. Please give the video a like. There's a lot of information here, I know, but at the end, I'm going to break things down and put some timestamps on the video so that you can just go to the particular area that you're interested in and follow up. But this is really, I think it's good to have this space, this the facts in one video, so that you can get the information you're looking for. I know lots of ladies do research around these topics. I've had lots of questions coming in around this area. So I think this is a really great opportunity if you're interested in information around this subject. So thank you so much for watching. Don't forget to like the video and do consider subscribing to the channel. So we're making good time. Next, we're looking at how long does it take to recover from ovarian cyst surgery. Now, this depends on the type of ovarian cyst surgery that you're going to have, and it could range from a few days, under a week, to a couple of weeks. Now, most often you would have a laparoscopy, and a laparotomy is what you would have to treat the ovarian cyst. Now, if you're going to have a laparoscopy, that is minimally invasive surgery. So what that means is you're going to have small cuts into your tummy, into the abdomen, and through those cuts, the surgeon will insert a laparoscope. A laparoscope is a thin instrument that has a light at the end, a light with a camera at the end. So they pass it through those cuts, and that allows them to be able to see into the abdomen and identify the cyst, identify the organs, identify the cyst. And then they can make some extra cuts into the abdomen where they can then put in other equipment, other material devices that they can use to get hold of the cysts, cut them or remove them, withdraw them, all the while looking with the camera and the light that they've introduced through the laparoscope. So doing that's minimally invasive because they've not made a big cut into the abdomen. Now, again, the choice of process, the choice depends on the size of the cyst, because you wouldn't be doing a laparoscopy if you have a very large cyst. For a very large cyst, it might be necessary, of course, it will be necessary to actually go in, do a cut on the abdomen to be able to bring the cyst out. So it all depends on the type. And so how long you're going to recover depends on the type of surgery that you've had. And if all you've had is a laparotomy, where they've put the laparoscope and they've been able to remove the cysts through those small incisions, then you should be able to recover quickly, barring any complications, which again, because the procedure we're so familiar with the procedure, it's not so complicated, but making sure that there is no abnormal bleeding, no infection, and so on, you should be able to recover and come out of that within a few days to a couple of weeks. Of course, for major surgery where there is a cut into the a large cut on the tummy, on the surface of the abdomen, you might be looking at recovery from 4 to 6 weeks. Like someone who's had a cesarean section, that's the kind of recovery that you're looking at, recovery time that you're looking at. So it depends. Is it a laparoscopy, or have they actually gone in and done a full cut on the abdomen, as if they were doing a cesarean section? So that's how long it will take. Now, this is one that I know a lot of ladies are interested in. How can I prevent ovarian cysts from happening? How can you prevent ovarian cysts from happening? Now, if you listened to the first part of this video where I talked about the types of ovarian cysts, you know that we don't know all the causes. We think we have an idea, but we talked about menstruation and something going wrong with the menstrual cycle, but we don't know all the different causes. But with the studies that we've done, we think that there's some things that can help some ladies reduce the risk of them happening. One of them is that we've noticed for women who use contraceptive or birth control pill, which prevents ovulation, that they're actually less likely to have cysts. Why? And particularly less likely to have dysfunctional cysts, because we're delaying or preventing ovulation. So if that whole process is not happening, then nothing is going to go wrong. That's just how to look at it. So women who are on the birth control pill, less likely to develop cysts. It also applies to women who do not smoke. Women who don't smoke, less likely to develop cysts. So studies have shown us that is a benefit of not smoking. Another benefit, and there are many, many, many benefits of not smoking. So if you're concerned about developing cysts, please avoid smoking, because studies, science has shown a link between smoking and developing cysts. Okay. Something else to think about is weight. We've also detected that cysts are more likely to happen in a woman who is overweight or who is obese. So somebody whose BMI is above 24.5 and under 30, that's overweight, or somebody whose BMI is above 30, which is obese, they are more likely to develop ovarian cysts. So if it's something that you're thinking about, how can I reduce my risks, then look at your weight. Look at if you're smoking, stop smoking. I'm not saying if you don't need to take the pill, doesn't mean that you should go and start taking the pill simply because you want to prevent cysts. But it is an added benefit for somebody who's already using the birth control pill, that they're less likely to develop cysts. Don't forget, it's important to know your family history, because sometimes ovarian cysts can run in families, not often, but some women may have cysts and they may have their mothers or their sisters may also have cysts. So sometimes it might run in families. So being aware that you may be at risk of developing those cysts, so that you can speak with your doctor and then look at regular monitoring, either with a scan or having blood tests done to establish whether you're developing a cyst. And we also talked about the chance of cysts developing around menopause. So as we get to that age of menopause where there is hormone changes, that's the time that a woman may develop cysts. So if you have those symptoms that I talked about, like bloating, pelvic pain, you're eating and before you've had a couple of spoonfuls, you're feeling full, or you can feel your tummy is swollen, you're having pain during sex, or running to the toilet very often to pass urine, those symptoms I mentioned above, then please see your doctor to discuss. And the next thing that they should do after examining really should be looking for an ultrasound scan for you. Okay, so we are doing quite well for time, and I hopefully won't keep you guys much longer. Let us go to question number 7. Are there any natural remedies or lifestyle changes that can help manage ovarian cysts? I don't know what you guys think, and if you have any thoughts about this, I would love to hear from you. Are there any lifestyle remedies or changes that can help manage ovarian cysts? Well, I think I've given a clue to a few of them, like weight, like healthy eating, regular exercise. All that will help keep you in healthy shape. And we've seen that studies also show that reduced weight helps to reduce the risk of developing cysts. So there are no specific herbs or supplements that we can say will actually prevent you from developing a cyst. But there are many supplements there that can help with pain relief, that can help to reduce inflammation, because we know that inflammation can have some effect and can have some impact in abnormal tissue growth. So there are some of these things that you can use simply to keep healthy and then hopefully reduce the risk of them or having too much trouble with ovarian cysts. But there is no specific method that you say, right, take this and you will not develop ovarian cysts. What we just recommend is for as much as possible a healthy lifestyle, which incorporates regular exercise, healthy diet, and really important, mindfulness, avoiding stress, because all these things can contribute to excessive inflammation, which can create the room for abnormal tissue growth. Okay, so the next question that I want us to tackle is, when should I seek medical attention if I think I have an ovarian cyst? Now, I know I have said that most of these cysts are they're benign. They happen commonly. Many of them don't have symptoms, but if you have symptoms, they will settle quickly. That is the functional cyst. I know I've said that. But if you have, if you develop cysts and you think that, or if you develop symptoms and you think, I wonder if I have an ovarian cyst, when should I speak to the doctor about it? I would say as soon as possible. Okay, I would say please come and talk to the doctor. First of all, let us establish what is actually causing your symptoms and let us be clear what they are. And it's better that we know that there is a cyst, and so we decide to monitor it, than you sit down and wait and watch and to see what happens, because at that point we don't know. If it's not one of the common cyst types that settles by itself, what if it's another type? So please don't ignore it. It's not wasting any doctor's time for you to go and say, I'm having these symptoms, I'd like it to be looked into. Like I've said, to be able to make the diagnosis, examination of your tummy, of your abdomen. They would usually request an ultrasound scan, and they may request a blood test as well in order to evaluate the cyst. So I would say as soon as possible, if you do develop any of those symptoms, please come and speak to your doctor so that we can evaluate the symptoms and make an establish a diagnosis. Because even if it's the type, the functional type, which we know is benign, we want to monitor it and make sure it is going the right way. Make sure that it's not growing, because even the functional cyst, if it's growing, or if it's a corpus luteum cyst that's growing bigger and bigger, can cause problems, can cause pain, can burst and cause problems. So that's why it's important to get it checked out and don't ignore it. Right, so we are going to the next one. So, are ovarian cysts cancerous? Thank you so much for watching. Don't forget to give the video a like. And subscribe to the channel. So this is the question that many women want to know. And I think that if you've been listening right from the beginning, I've said that most of the time that ovarian cysts happen, they are benign. So most ovarian cysts are not cancerous. Okay, they're not. But a small number, a tiny number are malignant. Okay, they are cancerous. They are often more likely to develop around or after menopause. So that is the age around which, if a woman develops a cyst in the ovary, then we will be we'll be investigating very aggressively. You want to establish what kind of cyst is this, and so they'll be having the scans, they'll be having those blood tests to look at the levels of those chemicals that might indicate whether or not this is cancer or whether this is a different type of cyst. So the other thing is that if a woman has a family history of ovarian or breast cancer, she may be at a higher risk of developing ovarian cyst, ovarian cancer. So those are the sort of cancer links, and the symptoms are pretty much the same. So again, I'm going to go through them, the symptoms, because when you're talking about ovarian cancer, what are the symptoms? It may start with that feeling of fullness or bloating that a woman might experience. She eats only a little bit and she feels full very quickly. She can't button her blouse or her coat or zip up her skirt or trousers, or just signs that the tummy, the midsection has gotten bigger. There might be problems with period. They might notice changes with the period. Like I said earlier, they might notice problems with passing urine. They're going frequently to pass urine and it's not an infection. There is no burning or stinging. There is no blood in the urine or anything like that, but she's running frequently. That might be a sign of pressure, the bladder being squashed by the growing ovarian cyst or cancer, or problem going to toilet to do number 2, to do a poo-poo, because the cyst is pressing on the bowel. So nothing is going through the bowel, and you're feeling constipated. You're struggling to pass, stools, simply because the bowel is squashed, because of the pressure from this cyst or the cancer. So they do share similar appearances, which is why if a woman comes with those symptoms and she's in that age around the menopause or past the menopause, she should definitely have the scan. She should definitely have the blood test so that we can identify as soon as possible what is causing it. Now, here we are, nearly at the end. Well done for sticking around. So this is the question that many of my ladies want to know, and I think it's a very, very valid question because, of course, the ovaries are so important in reproduction, and we explained about how functional cysts can develop and how we suspect other cysts develop. So this question is, can ovarian cysts affect my fertility, and what are my options? So usually fertility is not affected by ovarian cysts, usually. Okay, and I say usually because remember that most cysts are functional. They are harmless. They do happen because something's gone wrong with the menstrual process, the menstrual cycle process, but the body does recover. It's not a permanent change. So those cysts will eventually shrink and the body takes care of them. If they don't, then we can have surgery or treatment to remove them. So these cysts are not going to cause any fertility problems. The ones that may do are cysts that happen in the context or in the conditions where there's polycystic ovarian syndrome or endometriosis, which I've described already. And so what we want is for women who have these conditions to speak to their doctors about the issues with fertility. And then you can look at the options, because there are different options depending on how severe or along which part of the spectrum on those conditions that you have. Every woman with PCOS can have different symptoms. Not all women with PCOS have trouble having children or trying to get pregnant. So women have different issues, different symptoms, and the best thing to do is to sit down with your specialist so that we can look at what are your specific symptoms and how likely or not are you to fall pregnant. So there are things that can be done. So we're not going to say a blanket that a woman who has PCOS or endometriosis is unable to fall pregnant. That is not true. Each woman needs to be evaluated, and then we can decide what her chances are. But in terms of ovarian cysts, generally, having an ovarian cyst does not mean that you have fertility challenges. They are different types. Each one needs to be evaluated. Majority of the time, they do not affect fertility, but we do have some small percentage, some small group where they can be a problem, and that should be evaluated by a specialist. Friends, thank you so much. We've come to the end of everything I wanted to discuss with you. I think number 10 is particularly important because not understanding ovarian cysts makes us feel very anxious, particularly about symptoms like fertility, which is so important for us. And I hope this video has helped to explain some of the impact. I hope it sort of helped you to think around symptoms and come to your doctor, or like I said at the beginning, use our email health information service if you want to discuss symptoms more with us or get any more clarification. The link will be in the description box for this video. Soon after this live stream ends, if I've not put it already, please send those questions or comments through to me. But I want to thank you so much for spending some time with me. Thank you guys for those watching live. I really appreciate it, and I do hope you found it helpful. Please give the video a like before you leave, and I hope you have a lovely weekend, and I will see you in another live stream in a few days' time. Thank you so much. Take care. Bye-bye.